BBL podcast. I'm your favorite host, Franklin, the custodian of the citizens of the Federal Republic of Nigeria.
What their name?
Interesting. Okay, say that again. Let me cost rep.
Of the citizens of the Federal Republic of Nigeria. Yes.
That's such a big name.
And my name is
CFI.
Kene Ezama. Sorry to interrupt them. You're welcome to air your voice, your thought. And I've got a guest here in the studio on the podcast session for today, a medical lab scientist,
Yeah.
Mr. Chima. What's about you doing?
I'm fine. Thank you for having me today.
Yeah, you're
Thank
welcome
you.
to the show.
Thank you.
So we're going to dive into it. We wanted to get your opinion on the pandemic. Let me use the word pandemic for that.
Okay.
The thing that is thriving in the women's world now.
Also men's word as well, though.
Do you know what I want to say? The butt enlargement thing.
Definitely, some guys are also doing that currently.
I'm not
Maybe you
aware.
might provide more context to it.
Definitely, I
Yeah.
will try. Yeah.
So, is this something that
I
reflects to your field? No, your field. Or
But enlargement
yeah,
is a thing, you understand, that has been there ever
Okay.
since.
Yeah.
Just that, in quite recently, it became more popular. And the reasons are not far-fetched, you understand. More people that we idolize, like our celebrities, our female celebrities,
Yeah.
are out there doing their butt enlargement. In fact, some of them hang their cameras, you understand, and walk you through the process, you understand, for the butt enlargement thing and all that. And you get to find out that people, because obviously we have the Gen Zs, these young women out there. It's the social media era, so it's so easy for them to influence these girls, you understand, to pick their little this thing from them and want to crave it, you understand. It's a very I would say that as a matter of fact, people who haven't done that at this point are people who are probably saving for it, or people who can't afford it. But if you call it a pandemic, I would say yes, it is definitely a pandemic. And there are serious health concerns as regards that.
So before you get to the health
Okay.
concerns, I wanted to ask you, when you say that there are reasons, people, they could influence a lot of young persons. There could be reasons why the influence is easy.
Okay, yes.
What-
Okay,
what-
yes.
what could be the reasons?
Okay,
What could be the benefits?
I've watched some of them talking about how, okay, for some of them that are they have dealings with people that matter in the society. There's a time they were saying this thing that that Nyash, like they call it, is in high demand. It's a huge market. It hasn't been, yes. So you find out somebody. I think I've listened to one of Blessing CEO's documentary where she was talking about how men now draw and are all over her.
Unlike before.
Unlike before. It's like
That's the benefit for her.
exactly. So when it's just that simple. Just go to your social media, have your camera positioned in your ass. It's now big, and you do your thing. I think that particular podcast was Nedu Wazobia. I interviewed her, and she made that remark. And when people listen to things like that, you understand, they begin to think, okay, yes, for some of them that are in the streets actually may want to have that done, so that for them to have a larger audience.
Okay.
Yes. So if you say yes, that is for one. First one is for aesthetics. You understand, their beauty, the curves. You understand, when they wear their clothes and go
They
out,
come out
you look
better.
at them too. Yes, and also there are some of them that but if you ask me my personal opinion about that, I would say whatever rocks their boat, whatever rocks their boat is okay. Yes, because you find out that some people may have this insecurity. You understand? They may have this, yes, based on their body structure. They don't have the
physique.
ass, yes, the physique, the rest of them. So if they go, if they've decided and this is what they want to do, who am I to hold them back? And I can even make a particular remark with somebody like this former BBN
Messi,
housemate, not Messi, not even Messi.
Chacha?
No, Chloe.
okay.
Yes, I knew
she
Chloe.
did as well,
yes,
yes,
and her
before
own
and
came
after.
out very nice. Chloe you see today is not the Chloe you had in the Big
So
Brother house.
Chloe of today is better for you.
Beautiful, she's curvy. In fact, she she tries as much as possible now to flaunt her body because she has
your
it.
expressions are really interesting about Chloe. So I want to make it a bit personal question. Would you have, assuming you wanted to do something with Chloe of before, ignored her, would you somehow favor someone who has done the butt enlargement over someone who hasn't?
Before,
But
you're putting me on the spot.
I'm not putting you on the spot.
Yes,
But can we talk about you appreciating it, the way you appreciated it right now? Is this something that you love? Is this something that would make you, just like you said, draw over such figure?
Yes, I compliment a lot. I don't hold compliments.
Okay.
And when I see a good one, I commend it.
Yeah, I'm just using it as an experiment for men now.
Okay, yes. For men, what I will say is this: it's not going to, if Chloe's personality before is giving me, based on the particular subject, what I want her to do for me.
Yeah.
If it's for attraction, you understand? Yes, she's not my type.
Yeah.
Then, but a bit of it now, yes, yes. But I prefer her now.
Now better than
Yes,
your
than
daughter.
before, obviously. But just know that if it's something that is going to benefit her, I would not use because of her looks or whatever. Then to deny her that. If she has the right personality to get whatever, she can. Even now.
Oh, interesting.
Yes.
So you're about
it's
telling
not
us
going to
about
affect.
the health hazards for such procedure.
Yes. Some of these procedures are quite invasive, and all I'm saying is, if you want to have that done, please make sure whoever is touching your body or doing those reconstructions is licensed enough, you understand, to do the job. You understand? Because we are having this increased number of people dying in surgery rooms trying to do a butt implant and stuff like that. So if it must be done, please, as much as possible, go to a licensed person. When I mean licensed, a doctor who specializes in that area is the only person licensed to do that job. Please demand their license, verify it. I also want to implore the Federal Ministry of Health, if possible, to wade in and checkmate whatever that is happening in that area. Then again, yes, if clearly these procedures, there are a lot of there's heavy use of carcinogens. You understand? Some of these things they use for the procedure and all, are somehow, they have serious health effects that may not happen now. It may happen, yes. So make sure that's why I'm saying that, make sure that whatever you're doing, even the checkups and the rest of them, that it is done by a licensed person. At least the person will do it under strict regulations. You understand? So if it's done, then that's fine.
So the next question I wanted to ask you was about the regulators. You mentioned Federal Ministry of Health.
Yes.
Tell me about Nigerian Medical Association and how they check this, because apart from the surgical process, I noticed that some celebrities on social media, they advertise cream,
Okay.
the ones you can rub and a certain part of your body will enlarge.
Yes.
Now, this is self-usage. You don't need anybody to do it for you.
Yeah.
Just buy the cream, keep rubbing it on bum, it will just enlarge. Even there are ones that they sell. Now, I want to include your pum pum, like
Yeah.
the V.
Yeah.
Rub it there, it will be creamy, something will drop in,
Okay.
you will wet everywhere.
Okay.
It's self-usage.
Yes.
I don't know how we got to this level. NAFDAC is there, Standard Organization of Nigeria is there, but then how is Nigerian NMA coming together in sort of a collaborative work to do this and do it well? It's as if they're sleeping. We barely hear anything about them in terms of press releases, in terms of any regulatory information.
Yes. Okay. Thank you. Actually, the parent is the Federal Ministry of Health.
Okay.
Yes. No, nothing concerns health. You understand, in Nigeria, that shouldn't bother the Federal Ministry of Health. So it starts from the Federal Ministry of Health. Then it now rolls out to both the NMA, the Nigerian Medical Association, then the NAFDAC on the other side, you understand. But if you talk about the people that it should be particularly
Their
directly,
responsibility.
yes, direct responsibility, I would say it's NAFDAC particularly. You understand? And there's even a drama that is playing out lately. I don't know
Yeah,
whether
the
you
Very
guys have
Dark
been on-
Man drama?
Yes,
The protests.
The protests. You understand that Very Dark Man staged in front of the NAFDAC office, demanding them to be. In fact, he's demanding for an outright sack
Of a certain man from a
certain
department.
man from the department. Yes, that he's not living up to the expectations. It's as if NAFDAC dined with Professor Dora Akunyili, and quite sadly, it feels so. And things like this, I know that if you go on Instagram now, 1, 2, 3 swipes, you see somebody, unlicensed person, you understand, advertising a product, doesn't have that NAFDAC number. The person knows nobody ever checked the contents of whatever he or she's selling. You understand? So you find these things, and we wonder how non-communicable diseases like cancers on the high side now. You understand? These are some of the reasons, because people are rubbing things they do not know on their skins. You understand? And these things have consequences. It may not be now. You understand? It may not be now, but people are coming up with so many different types of cancers, and some of them are linked to using some of these products. So it's even a call to Federal Ministry of Health to put strict regulations to all of that, and also having the people directly in charge of that, which is NAFDAC, to also do their job. Make sure that whatever product anybody anywhere, even if it's healing water, like the case of the pastor, whatever, you understand, you are marketing, you're actively marketing this thing for people's consumption.
And no NAFDAC number.
Yes, no NAFDAC. It's not supposed to.
Even when they get
anything
NAFDAC
that
number,
anybody is
complaints.
supposed to consume has to go through NAFDAC, and they should have a NAFDAC number.
My question is mostly on what you were saying earlier about the surgeries that is happening.
Okay.
Who does these surgeries? Are they medical doctors or people in the aesthetics department, or who?
There are people actually, there are licensed people, that there are doctors who specialize in, they call them beauticians. You understand? Cosmetic surgeons.
They went to medical school.
Yes, passed through that. In fact, is one of the most lucrative areas that female doctors delve into. Yes, you understand, aesthetics. So those are the people that are licensed to do this job.
Do we have such school in Nigeria, just to cut in a bit?
There are special some of them do go outside the country
Okay.
to study those things and build their capacity on that.
Okay, continue.
Yes, but it's part of what they study here, but it's not
Extensive.
Yes, it's not that extensive. No, you must have a special. As a doctor, once you graduate from medical school, you start your residency program. That's at the end of the day, when you pass through that thing, you become a specialist, a consultant in this particular area. Yes, so that's this thing is like one of the branches that somebody can specialize in. So make sure that whoever you're meeting is somebody who is a specialist in that area. Then there are people also who maybe through 3 months training they underwent abroad or something, one place or the other. They went to a school like that. They disguise and come back to Nigeria, label themselves doctors, and yes, people come to them. They know some of these jobs, but they are not anything that has to do with opening a human body. There are complications that can happen. You understand? And I still insist that whenever it's to happen, please make sure that you're doing it with somebody who is licensed to do that. You understand? The whole spa treatment and all what's not, the officials and the rest of them can be done by people who underwent, who were taught those things. You understand? But when it comes to those invasive procedures that you have to open up people's body, suck up fat, liposuction, and the rest of them, it has to be done by a doctor.
There is a competition amongst spa owners in Nigeria. You move from street to street. The way you see churches, the way you see drinking joints, you also see wax your body, come for spa session. And then you step into the spa, you notice they are not massaging, they are also injecting. In the city where we are, I've noticed that over and over again. And then it's as if they are competing for the medical job or trying to compete with those who do the surgeries. They will tell you it's not surgery per se, but then we can just inject your boobs and it will enlarge and look fresher. What do you have to say about this? Because they are being patronized even more than those that do the actual surgery, because it's cheaper and the results is seen faster.
Like I said, I still take it back to first the Federal Ministry of Health, then the state ministries of health are more interested in doing in regulating outfits that are run by professionals than stopping the ones that are run by non-professionals. Do you understand me? Yes. So for somebody like me, you understand that own a center, not in Anambra though, in Enugu. Yes, you find out that we know the procedure, we know what you're supposed to do. You understand the registrations, everywhere you're supposed to register your outfit and how the process is supposed to go before you open your outfit. Then the government also keeps a blind eyes to these centers. You understand? Like the one you mentioned. For somebody who injects something on someone and the butt gets bigger, you understand? What is the person injecting?
Not
It's
just
a
the
chemical.
butts. There's one they do in the pum pum. They call it the protein injection. They do it so that your
there's
pum
a
pum
time
will
there's
be
this
bigger,
tightener, the tightening,
tightener.
this thing.
That-
we
that's- that the
had a
pinkish
lot
ones,
of them.
the
We had
coloring
a lot
ones,
of
the
there's a
tightening
very
ones,
there's a very popular person, is it Jaruma or whatever she was called, all those people, government should come in, because whatever they are selling, people are consuming it. People are taking it. And what are the contents? What's the content of that thing? You understand?
And what is it tightening?
And because everything has a mechanism of action. What does it do to achieve this say this particular thing you're claiming. So you find out that nobody. It's just that we have weak regulation. A weak regulating system is the problem, because we are supposed to look at what those people are doing. You understand? Make sure that we'll find a balance with them. No, the ones just like we have over-the-counter drugs that chemists can sell. You understand? And the ones that you're supposed to get at a pharmacy with a prescription note. Nigeria haven't even gotten to that level, but that is what it's supposed to be. People can go to a chemist and get any kind of drug they want. You understand?
Yeah, without doctor's
Yes, but
prescriptions.
what a patent medicine vendor is supposed to do is dispense over-the-counter drugs. There are drugs called over-the-counter drugs, but very serious ones like drugs for diabetes, drugs for hypertension, they are not supposed to be in possession of it, because little overdose with those things can cause instant death at times. Yes. So you find out that the major problem, the crux of the matter is, issues around regulation. If it's well regulated, you understand. Just like we have, you also say the herbal people. In fact, it's a whole lot of different people coming into rub shoulders with the real health practitioners. You understand. You on the other side, you see people into, they call it ethno medicine.
Okay.
The herbalists. You understand, who market their drugs openly.
So it's natural.
Yes. And I can tell you that some of them don't know the content. And another issue with that is that there's no dosage. And those things are gotten from, there's no form of processing that is done on those medicine. Yes, they will tell you that it works. You understand? Sometimes they do not doubt the fact that it works, but it's about regulation.
At what point do you stop taking
Yes, because drugs are taken before you have a drug that is commercialized. They have to establish the therapeutic index of that drug. Therapeutic index is the dosage that you can take, and it's enough to treat you and not cause you problem. Drugs are poisons generally. If you take overdose of any kind of drug, you see all the side effects manifest. You understand? So drugs, that's why drugs have dosage. That's why you see they tell you 500 milligram this thing morning and night. You understand? There's a reason why there's that regulation. It's enough to treat you. You understand? And not to cause you problem too. But when these herbal drugs and all these things that people are selling here and there, you understand, does it have dosage?
Yeah.
At what quantity of that substance will it start causing problem to somebody? But most of the times they're just particular about solving the problem.
Okay.
Then
And
at the end of the day,
they create
it
another
creates
problem.
another problem.
Interesting.
Most of them, especially, we've linked Abu for malaria. Yes, just something as simple as Abu. It's been seriously linked to people with young people coming down with CKD, that's chronic kidney disease.
Wow.
Yes, and so many other ones, like this injection that you say people go for.
Yeah.
They have it injected in their bodies and it bleeds. And whatever it is the substance is capable of just enlarging the muscles, the gluteal muscles, and anything that has that effect may be carcinogenic at the end of the day when you inject a overdose of it, or when it's not regulated. So you find out that they give you things that make you think your problem is solved, but another bigger one is lying elsewhere.
So my question again is, as regards the butt enlargement, right?
Okay.
That some of these unlicensed people are doing, and even licensed ones. Where does it relate to your field? Where do you people come in?
Okay, medical laboratory science does not have any direct link as such
Yeah.
with them. Rather, a beautician who is into such, when they have those surgeries done, they normally have some laboratory tests that's for monitoring.
Okay.
Yes, for monitoring, like the LFT, the liver function tests, the kidney function tests, just so many of them that they will request the client to do. That is where the lab scientist can come and pick the sample, run them, and return the results. You understand? Not that you have any full direct contact with this. No, we don't. But we can work for the doctor. You understand?
Yeah, he's
The
handling
doctor
the
can
procedure.
find, yes, the doctor the doctor that is handling the procedure can make a request along the line for several tests. Just like there's this person, she underwent the process. This popular transgender we have on social media,
Bob?
not Bob. I think he stays
James?
in no. There's this one in Port Harcourt.
I can't remember.
There's a time during the surgery, in fact, it was
Okay, that came
rumored.
begging for money.
Yes,
I am dying.
he was doing dialysis.
But looks like clout anyway, because at the end
it
of
was
the day,
not
it was
clout.
Oh.
It was pre this thing. He had onset of renal failure.
Wow.
Yes.
Onset
And he
of
can-
what? Sorry.
renal failure.
Renal.
Renal
Okay,
failure.
renal failure.
Yes. And it's something that he needs to be doing dialysis and also checking his kidney function tests. You understand? That's where the lab scientists can come in and run these tests as they are requested. So the main person that is involved is the beautician. Then, but just like the profession itself, medical lab science, we work. In fact, we do most of the behind the scene jobs in the hospital. You understand? Yes. We do not have direct contact sometimes with patients. We are not allowed to consult or do clerking in a typical government setting. Yes, we have our department. The doctor does the clerking, makes a request for a test, and sends the person to the lab. The person comes in, received, proper identification done, samples are collected, and clients will leave. Results will be sent back to the doctor to manage the clients.
So, then again, I want to add, I have heard that this, ab initio, I thought when they do these surgeries, it's being closed up and everything goes back to normal. I heard it's being managed, like the process. Where
Yes,
do you people
yes,
come in
okay.
again to manage
Okay,
it?
now,
And
I am not so versed in this area.
Yeah.
So I'll just speak from what I know. Yes. So I believe maybe next time you might need to hook up with a beautician proper
Yeah.
and have him or her answer these questions.
Okay.
So yes, when they do this, it's not just a one-time surgery. Yes, it's not just a one-time surgery. When you do the surgery, yes, you have to be coming back for
Checks.
the checks. Yes, regular checks. Yes. In fact, what I'm saying now is even from when Blessing CEO, particularly when she had her own dog.
Yeah, conversation.
She came out, walked people through the process. Yes, she's even the one that made me understand, okay, so this is what they do. It doesn't just end at doing the surgery. You understand? You must be coming for checks. You understand? I think there are some injections that needs to be because there should be side effects of some of these things. So you don't leap back, some start gaining weight and all. So things to also, they manipulate the hormones and the rest of them. So it has to be, all those injections has to be given for a period of time or so, then for the wound to totally heal and everything before the person is okay. But that doesn't mean that that person will not still be going, they will still be going for checks, because I've seen badly done procedures where
Her own, though.
infection, not
How's looks that, though? Continue.
I'm not, what I'm saying is not
The shape.
the aesthetics. Yes,
Okay.
I'm not I'm not
The
concerned about
decaying ones.
Yes, you find out that some of them, you understand, when they get this infection and they don't know it, especially, yes, the organism starts eating up the flesh. Before you know it is a large wound that is no longer healing. You find it around the ass, you understand, and it kills them. So that's aftermath of some of these procedures. Some of them may think it's just a one-time 5 million naira that you pay and you have the surgery done. You must be maintaining that. You must be maintaining that.
I don't understand. Maintaining in what aspect? You maintain your butt or you maintain the surgery?
You have to come for regular checkups. Checks. You understand? You have to come for regular checks. Make sure that, okay, the person is okay. You even do a general body check too, to make sure that...
And when he gets infected, you people take samples to check?
They treat.
Okay, they treat. Okay.
The next question I want to ask is as if the non-professionals, the term you used, are all on social media, marketing, pushing, gaining attention. Followership is the new gold.
Yes.
Getting paid, getting endorsements,
Exactly.
advertising cream. What is stopping the professionals from being on the media? Like, I see a Aproko doctor and what he does. It's as if he's just very few of his type.
Yes, okay.
What is stopping you guys from besieging this same platform to preach things like this?
Okay, thank you. Actually, you know what it took me to be here.
Yeah.
You understand, personally.
Tell us.
I'm not. Yes, I told him outrightly, even before we started, that I'm not a media person. Once you shine cameras, I'm just here because I know these are familiar faces. If it's any other person, I wouldn't be having this conversation. I don't like media. I don't like media of any sort. I don't know. It's personal, very, very personal.
Or is it general for people in your
I
field?
don't know. Like, sometimes you're too busy. You understand? You can't have a doctor that have clinic days. You understand, from one place to the other. You could having your most of the times, people in the health this thing, they are so busy that, and they haven't. Will I say that we also not recognizing the need to leverage social media to push what we do? You understand? Yes.
So
a lot of times.
I don't want to put words in your mouth. So it's
Yes.
right to say that those on social media are not the actual professionals, busybody, right?
Yes.
Oh,
You
really?
can't have a doctor. You understand? You can't have a doctor always on social. Rather, what they can do is employ a social media manager. That is what some of these hospitals are doing now. We haven't really understood the need to be out there, to be more out there. Even you say some of these things that make people understand that there are people out there who are disguising as us.
We are white apron.
Yes,
We are
look
the
very
whole-
serious.
Yes.
Yes, they do. You find them a whole lot.